Charlotte now leads the state in the number of cases. And later today, the state health secretary touring the Mecklenburg County monkeypox vaccine clinics and talking about the response to the outbreak. It comes as health leaders remain encouraged by a steady shipment of vaccines. However, it could still be months before the general population has access to them.
A new week and a new hope for more monkeypox vaccines. On this week's Flashpoint, Mecklenburg County Health Director Raynard Washington said more help is on the way.
The CDC has released sort of a phase 3 of the vaccine rollout, and so we're expecting our volumes to increase.
Despite a big shipment of 2,000 vaccines last Monday, the county's waitlist grew to thousands last week. Going into this weekend, Charlotte accounted for more than half of the state's cases. Washington says that's likely because of Charlotte's large LGBTQ population, a group disproportionately impacted by the virus so far.
Because that community is being most impacted right now, certainly we would expect that there's more risk here in Mecklenburg County compared to other jurisdictions.
So where does that leave other folks who might not fall in the high risk category but are still worried about the virus?
Should the general public now be concerned about getting that vaccine, or we are not yet at that phase?
Yeah, we're certainly not at that phase. We still have low enough transmission here where I don't believe that there is a huge risk to the general public.
In fact, it could be months before the vaccine is available to the broader population. The reason? Washington says more vaccines need to be made. Still, after what many criticized as a slow rollout by the federal government, health leaders like Washington anticipate a steady supply of vaccines going forward.
The state health secretary will be here in Charlotte from 1 to 1:45 today.